So good evening, everyone. We are on to the ASI Time, which is on Wednesday evening. And today we have a very uh, important session, I would say, with Patta Radhakrishna sitting on the moderator's chair and would be uh, conducting interviews with Dr. Adarsh Chowdhury and Dr. Ramesh. So I'll just invite Dr. Rajgopal Shenoy to introduce. Hello.
Good evening. I am Dr. Rajgopal Shanai. I'm very happy to be associated with this today's unique program. And at the outset, I would like to welcome the moderator for this program, who himself is a legend and who is the founder of Learning General Surgery, and Dr. Patta Radhakrishna. I also take this opportunity to welcome the two other legends, Dr. Adarsh Chowdhury and Dr. Ramesh. It is also my duty to welcome here Association of Surgeons of India President Dr. Maruthu Pandian, Vice President Dr. Pratap Singh Varute, National Secretary Dr. Gaddi Divakar. We have a past president here, Dr. Praveen Suryavamshi, Dr. Prabol Niyogi, Treasurer Dr. Madhumita Madam, and advisor to the Academic Council, Dr. Santosh John Abraham. Today we are going to have such an interesting session of interviewing the legends, and that will be moderated by none other than Dr. Patta Radhakrishna himself. With this, I would like to now hand over the proceedings to Dr. Santosh John Abraham. Thank you, sir.
You are muted, sir.
Thank you very much, Dr. Rajgopal Shenoy. Dr. Patta, the stage is yours. Please.
Good evening, it's my privilege, an absolute privilege, I should say, talking to the living legends, Dr. Adarsh and Dr. Ramesh Ardhanari. Both I have interviewed earlier. And not only that, they are the top surgical teachers, not just in general surgery, but in surgical gastroenterology as well. And I profusely thank Dr. Santosh John Abraham for giving me this opportunity, and my respects to the President, Vice President, Dr. Shenoy, and Dr. Divakar of ASI for this opportunity once again. And Dr. Ramesh, has he joined it? I don't see him.
I can see you. I can hear you. I am on the. I will on.
Okay. You need to adjust your camera a little bit, sir, because your head is a little cut. No, the other way. Yeah, that's wonderful.
I just put on some more lights.
Yeah. Yeah. Now, if I can start off with Dr. Adarsh. Sir, can you describe your day today from the time you woke up till now, including what you ate for breakfast and lunch and in between? Dr. Adarsh, you can take a full 5 minutes to say that.
Okay, so I get up as always around 4:45 in the morning. So I have chronic insomnia. I don't sleep much. So I got up at 4:45. I had some coffee. Then from 5 to...
You made it yourself, coffee?
Yes, I make it myself.
Yes.
So 5 to 5:30, I read a little bit because there was a class in the morning. So I had to read for that. I always read whenever there's a class because I want to know more than my residents know. Then from 5:30 to about 6:30, I exercised and I did 100 push-ups. So I do 10 repetitions of 10 types of push-ups. So then I had my breakfast, which is always 3 egg whites, 2 brown bread slices. Then I have some cereal, I have some fruit, and I have one glass of lassi. I'm a Punjabi. So then I got ready and I went to the hospital. The class starts at.
You drove yourself or you have a
No,
driver?
I have a driver.
What is
And
that? What car do you own?
oh my God, I drive an Audi Q5.
Right.
So it takes me about 35 minutes to reach the hospital. So I reached the hospital. I was wearing a blue shirt, a white shirt, and navy blue pants and black shoes. Then I changed up into blue and I wore a cologne also today. So since you want to know everything, then I changed into blue scrubs and there was a class. The boy presented a case of a, a spen, a pseudopapillary tumor of the pancreas. So he's exam going resident. So he got about 7 out of 10 in his presentation.
You have a class every day?
No, we have a class on Tuesday and Wednesday. So there's a case presentation, and then he gave me some bad news about after the class is over, then we'd have a roundup about what is happened last night. So he told me about two patients. From one patient's drained bile was coming, and second patient's main wound feces were coming. So he gave me that news, and then he told me some things about the ICU, and then I went for the rounds. I'm very proud to say we normally have about 65 to 70 patients admitted under us. So I took a round and then I went to the operation theater where I did a bismuth 4 stricture, which was done somewhere. And then thankfully, we were sensible. We had PTBDs placed on this patient about 3 weeks earlier, made that area dry. It took me about 3 hours to set it right. And then I did the anastomosis, and then I came to the OPD. I didn't have my lunch today because there was no time. Then I came to the OPD, and in the outpatient, I saw a few patients. And then I took my round of the patients I had operated. And one patient came and fought with me because his bill exceeded. So then I discussed the surgery of patients to be operated tomorrow. And then I sat in my car and I came back home. And I came back home and then I was thinking of calling you as to don't ask me any academic questions, but then I thought it's okay if I don't know, I don't know. I'm not overdosed with the illusion that I know everything. I know a little. So I had my dinner. So I had two chapatis, I had some vegetable and some dal and some yogurt. And then I brushed my teeth, and here I am.
Oh, wonderful. Wonderful to hear that. Dr. Ramesh, your day since you woke up in the morning till
Uh,
now.
I'm not an early waker like others. I got up at about 6:30. I sleep by
That's
about
pretty
10
early.
p.m. I go to sleep at about 10 p.m. and then I like to have a nice 8 hours sleep. And luckily, I had the full sleep and got up at about 6. I loitered in the bed till 6:30. Then I got up, made coffee, had coffee. Then I sat on the computer and like others, I usually catch up on my journals, readings, and other things because I like to keep up to date. I usually tell the students the papers before they read it so that they know that their boss is on the toes and so they don't get this thing. Then I made my own breakfast, which I have every day. Is usually I make about 4 to 5 teaspoonfuls of oats, which I pre-made oats, which I then heat with some milk and with some raisins, and I eat that. That's my regular breakfast. Every day I have it. Then by about 8:30, my driver came, and then we left in my car to the
What car
hospital.
is that, sir? If I may
I
ask.
have two cars. I have an electric Tata, which I use usually for inside the city. And I have a others. I have an Audi Q5, which I use only for long distance usually, and once in 2 weeks to the hospital just to keep it running. But I usually when I go to Chennai or go to Salem or Bangalore or somewhere, I usually drive down. And I drive in that bigger car because it's more comfortable, and your electric car doesn't have much of a range. It has about 270 kilometers. So you can't really take it out to be charging it and coming. It's not worth it. It's for a small city drive, basic car. Then every morning we have a session where we all sit together, the entire department, and we review the last day's admissions, all the admissions, and we see the day's list. And we go through the list, and we also discuss any problems we anticipate in the list, any cases that we have some concerns about, and sometimes we change decisions there. So suddenly we may change a decision that looking at the CT scans once again, looking at everything, somebody will say, why not try some new adjuvant and then come back with a surgery after some time? And then we discuss about it, and once in about 4 or 5 cases, we change the decision. So we send the patient for a new, we just take him in, do a D-lap, then put a port, and then send him for new adjuvant. And today I had only one operation to do, and patient who had come with recurrent obstruction following massive midline incision. So he had some sort of adhesion. So I did a D-lap, adhesion release, and then we finished that off. The other cases were all done by the students. I didn't do anything else. I just saw my outpatient. So my outpatient is like a continuous flow from somewhere around 9 in the morning till about 4:30 in the evening. They keep coming in, and I keep seeing them as they come in. Whenever I'm free, I go and see these patients and send them for investigation. So the morning patients I see till 1 o'clock, they come with the investigations by about 4:30. So I see them then and there. Those I see later, they will come tomorrow back with the investigations, and then I will see them. And then I take a decision. Sometimes there's a problem in the case, then I look for either Mohan or the other consultant, and we discuss what could be the approach rather than me taking an independent decision. Because I think that that's one of the advantages institutions offer over individuals. You have somebody of equal experience and knowledge, 2, 3 people, and they can all put their worth of opinion, and then we can give a better answer to the patients. Then about 5:30 or so, I left the hospital. I came home. The first thing I did was I logged onto my computer, checked my email. I do it twice a day, once in the morning and once in the evening. 99% of the mail is spam, which is deleted, patak, 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 patak. Then there's 1 or 2 interesting things there. I look at those letters and I answer some of them. And then there will be some will be bills which I pay online. So those have to be paid online. So that is done. And then I had dinner tonight. We had bread and omelette. So 2, 3 times a week we have this so that it provides for us vegetarians a protein source, the eggs. So I take that. I usually have my lunch in the hospital. I eat something light, like a little bit of rice with a little bit of rasam or sambar in the hospital itself, in the my room itself. And then I'm getting ready now. After this, I will go to bed and have my 8 hours.
Anything, how do you legends spend your evenings? By the time you come back from work till you go to bed, anything special you do?
Nothing. I just read. I read on the computer.
What do you read?
My phone. I read all sorts of things. I read stories, thriller stories. I read new interpretations of mythology like Devdutt Patnaik and Ashwin Sanghi and other Indian authors who are now interpreting the mythology in new ways. And I enjoy that. You know, they come up with a story about Ravan, giving him a new face. I don't know how many of you know the story of Ravan. I just tell it, and it's just 2 minutes long. On the night before he goes to war, Ram suddenly, the morning before, he tells Jambavan that Jambavan is the senior most of his leaders. He is the oldest. He is a friend of Pulastya Muni, who is grandfather of Ravan. And he tells Jambuan that I want to do a yajna for Lanka Vijay. I want to pray to Shiva. Shankar is my God, and Shankar prays to me. We are both mutual, we pray to each other. So I says, I want a priest who will do a puja in favor of Shiv. But he should also be a Vaishnavite, because I come from the Raghuvanshi family, which is a Vaishnavite family. So Jambavan says, in the middle of the jungle, where will I find a priest like that? Then he says, there is one priest, but I don't think he will be your priest. He says, who is this priest? He says, who else but the great Ravan. He says Ravan is a Vaishnavite because he comes from Pulastya Muni's lineage, and so he's a Vaishnavite. But he's a great Shiv Bhakt, so he will not hesitate to do your puja, but he won't do your puja. Then Ram says, ask him. If he does, we will accept. So Jambavan goes to Ravan's palace. As he's going, Ravan's spies tell him that Jambavan is coming to visit you. So Ravan gets ready. He tells all his soldiers to form a guard of honor along the road and says, nobody will say anything. You will wish him, and then with your hands point the way towards my palace. They do that. When he comes to the palace, Ravan himself comes to the door, touches his feet, washes his feet, and then takes him inside, feeds him, and then makes him comfortable and says, he calls him Tata. In Tamil it is Tata. So Jamban, Tata, what brought you here? Because he is Pulasti Muni's friend. He is equivalent to his grandfather. So Jamban says, I have two Yajamans in the jungle who want to do a puja. Will you be their pujari? Then Ravan doesn't answer. He says, to my knowledge, your Yajamans are Ram and Lakshman, the sons of Dasharatha. Jambavan says, yes, he cannot lie to Ravan. And then Jambavan asks, will you do the puja? He says, is the object of this puja Lanka Vijay? Jambavan says, yes, that is the object of the puja. And then he asks Ravan again, will you do the puja? Ravan says, that question never arose. The moment you knocked on my door of a Acharya's door and asked and came in with the thought of asking him to do puja, I have to accept. That is my dharma. I have to accept to be the pujari. So I will be there. Then Jamban says, what is the muhurt? So, all the planets are under his feet. So he just looks at them and says, tomorrow morning at 5 o'clock, Brahma Muhurt, the time I was born, is the best time for the puja. Then as he goes, Jamban says, what all arrangements have to make? So Ravan says, I will make all the arrangements. As a pujari, it is my duty to make the arrangements for those who cannot make. How will you make arrangements in the middle of the jungle? So Jamban thanks him and goes off. Then Ravan wakes up Indrajit and tells him, go to Ashok Vatika, wake up Sita. I have to talk to her urgently. So half an hour later, Ravan arrives in Ashok Vatika and tells Sita, tomorrow morning your husband is doing a puja for Lanka Vijay. I will be his pujari. A married man's puja is not complete until his wife sits next to him on the puja palank. So 4 o'clock, 5 o'clock is a more time. 4 o'clock, Indrajit will come with his chariot. You wear new dress after bath with all your jewels and flowers. Get in the rath and come there. Once the puja is over, you get back in the rath and come. Your freedom is only for the period of the puja. Sita accepts it. At 5 o'clock, Ravan arrives. As soon as he arrives, Dashrath and Ram and Lakshman rise up and says, Dashrath Putra Ram or Lakshman Putra Lakshman, आपका स्वागत करते हैं. We welcome you. So immediately he says, Vijayi Bhava.
So we crossed 2 minutes. You have to sum up in half a minute.
Yeah, he says Vijayi Bhava. And then he says, okay, have the puja. As he starts the puja, he asks Ram, are you married? Ram says, I'm married, my wife is not with me. So Jamban knows the importance of this. He says, what should we do now? I told you, Jamban, that whatever arrangements have to be made, I will make. And he gets Sita from Indrajit and makes her sit there and completes the yajna. And at the end of the yajna, he says, with all the gods who are watching this yajna, I tell you that the reason for which you did this yajna, you will be successful. So the enemy gives the enemy the right of victory. So this is just a story, just to say
Wonderful.
that everybody is not evil and not all good. Even a man like Ravan will give Ram the Vijay Bhava title.
Great,
So,
great, sir. I'll give 2 minutes to the Adarsh as to what he does in the evenings. You have to unmute, sir.
So I read a lot. I read, but I always read non-medical stuff at home. and medical stuff in the hospital.
You have
And most,
thousands of books on your
oh, it's
iPad.
okay.
You showed me the other day.
Yeah, yeah, yeah. So I
Even
am
I,
basically I don't read any fiction or any stories because my life is equally very interesting without any fiction. So I only read about thinking, biases, decision making. I'm very interested in European art, so I study about European art, and so that's what I do.
If I can ask both of you, did your paths cross anywhere? In sense that did you work together, study
no, we
together?
have
We
never worked together. The first time I met Adarsh Chaudhary was in 1998 at the IASG at Jukmar. I remember that distinctly. That's the first time I met him because I'd heard about him so much. I had heard legends of Adarsh Chaudhary. And more than that, I'd heard severe criticism of Adarsh Chaudhary from a gentleman I will not name. And so I wanted to I want to meet this man who has made so many people with divisive opinions. And that day I met him and I talked to him. And over the years, our thoughts have been so similar in so many aspects that we became good friends. And we both enjoy this comic, lewd humor. So that has become one of our joining spaces. And I've always enjoyed it. And I missed it for the last few years because we have not been attending conferences together.
And what do you like in others, if you can say in a few words?
See, I like in others that if I tell him a particular surgical case and say, what would you have done? His answer is almost immediately what I have done. And I think I also have given him similar opinions on what he has done. And I still remember one day he told me that I have received an offer from Gangaram Hospital. Should I go or should I not go? He was at Mamsi at that time. And I told him that you should go. Today they are calling you. Tomorrow, when you want, you will be asking them, you will be in a disadvantage. So go now when they are calling you. I think that so that made him from a great government surgeon into a great surgeon overall. And that lifted his profile completely among the people of India.
Adarsh, when did you exactly meet or you remember meeting Dr. Ramesh, and what is that you liked in him?
He's already explained when we met. So the most important thing I like about him is that he likes me. So and second thing is, whenever I have a problem and I goof up a case, I used to call him, and it used to give me a lot of sadistic thrill that he'll also agree that he's made the same mistake. Because there were some surgeons with whom if I'll talk, they'll make me feel that I made a big mistake and they never had this problem. So I always used to have a collective sense of inferiority with him when we both made the same mistake. So I love his honesty. I love he's well read. And the one thing I love about him is he's so biased. I love that because it is good to have opinions. So I love that he has his convictions, he's well read, and me and he have had great times in India and abroad. So that's what I love him. He's a transparently honest man. To me, that's one of the most important things I've learned.
Now, if both of you have sort of different training patterns, like you from Shimla Medical College, then Chandigarh, then to Delhi, and Dr. Ramesh is from CMC Vellore to All India Institute to Madras Medical College. I mean, a diverse. I mean, does this anyway influence your decision making that Ramesh makes in a certain way and you make certain other way?
My belief is my belief is one thing. I think essentially I'll speak on Ramesh's behalf also. I think you should take your job seriously, not yourself too seriously. Me and Ramesh have always taken surgery seriously, but as individuals, both of us have got up and agreed that we have failed times, some things we don't understand. We've never believed that we know everything. Am I right, Ramesh? We
Yeah,
both
absolutely.
have believed, both of
Absolutely.
us have agreed that
We
this
have
is
accepted in front of audiences that
audience.
because of our complications, patients have died, and what we have learned from those complications so that the others may benefit from that experience. Some of the surgeons just get up and say that they never had any complication. I have no leaks. I have no things. And both Adarsh and I know that it cannot be possible. You operate enough, you will have these complications.
But I will tell you a story about me and Ramesh. It sounds like uh, Abhishek Sharma and Sanju Samson. We both went to Malaysia for a workshop in a place called Elo Star. Between two of us, in one day, we finished about 11 cases, just both of us, which included a median pancreatectomy, hepatectomy, gastrectomy, Whipple, and a shunt. Remember, Ramesh, between two of us, we finished 11 cases in one day. So that was so interesting. We both of us did, I think, when we were in Alustar in Malaysia.
And I still remember one conversation in Bhopal, Pata. It was an IASD meeting, and David Nakao had come from Japan. And David Nakao was talking on a series of cases where he has done a right hepatectomy, a pancreatic or duodenectomy for a CA gallbladder, and he has reconstructed the hepatic artery and the portal vein using grafts and everything. And he was speaking of a 25% 3-year survival rate. So others turned to me and said, Ramesh, what is your survival rate in such cases? I told others, in such cases, at the moment, I'm talking of 3-hour survival rates, not 3-year survival rates.
So actually, I was always intrigued as to how these legends were when they're during their MS general surgery training. How was their schedule? What is that special about them? How did they spend their time? Because I fooled around too much during my MS, so I just want
I
to.
did. I mean, MS, I was very hardworking. I'm absolutely.
What is hardworking? You mean?
Hardworking means I was there at 8 in the morning. I didn't care what time I was up to. Many of my colleagues were married and they didn't want to do night duties on the days when we didn't have admission days. And they would give me that pager and go. I would sleep in the ward and I would take a night rounds, put everybody to sleep by giving 420 to all the post-op patients. And the nurses will be peaceful, I will be peaceful, and I will sit in the duty room and read. The duty room in AIMS was air conditioned in the summer and heated in the winter. So it was very comfortable rather than sleeping in my cold room or my hot room. So I used to be reading there the subject, and I read in detail the subject in my MS days and my senior residency also. And I was very, I mean, and I used to prepare the discharge summaries and all, even in the night when I was sitting there. It will be all ready. The others will come in the morning and in a hurry write that there, but mine will all be ready. And Dr. L.K. Sharma once told me I was the best resident he has ever had. And I think that is a moment of pride for me because my hard work, I think, paid off in those days. And so I did a lot of surgery. I did a lot of surgery and I made my juniors do a lot of surgery. And my juniors are among the most eminent surgeons in this country. Sadiq Sikora, Arvinder Singh Soin, Subhash Gupta, to name a few. They were all my junior residents, and so they all, and I used to give them plenty of chances. Every chance I got, I gave it to them. And they were so happy because they got so many chances.
So Adarsh, how was your PG training? What was your schedule?
No, I really don't remember much, but I just think I was lucky. I was surrounded by people who were very bright. So knowledge, flows down from. I was lucky because my seniors were exceptionally bright. So when you associate yourself with the right kind of people, you learn a lot. So, and I had very good mentors. My teachers were very good. They're very good role models. So, and one of the best ways to be successful is to see somebody who's successful and you emulate him. To my mind, that's the easiest way. I was fortunate that I was associated with people who were much smarter, much brighter, and much better than me.
But I
I think
also heard that Adarsh was a big hit with all the nurses in PGI, that he used to have lots of lady friends. This is what I heard from the grapevine.
I mean, that's what kept him in the wards in the nights.
I don't know whether in the wards in the night or somewhere else at night, but I was heard that he was very successful.
But this is news to me, sir. I'll talk to you personally on that. But others, between your completion of your degree till you became a consultant, that special period of senior residency or whatever, how important is that, and what should be the duration? At what point you felt you are independent enough to tackle surgery?
But I don't think it's possible to answer this question. Anybody who tries to answer this question is not being honest. It's a very indistinct point in surgical training. You don't realize that, it's a very gradual process. I will not be able to answer that. It has taken a long time to learn. We are still learning. So I really do not know how to answer this question. It's a very difficult process to understand because it takes a long time to understand
If the
knowledge.
others cannot explain, who else can?
So it's the problem with us as human beings is we do not want to accept ambiguity. We want answers to all questions, which is a wrong thing. There is no answer to this question. You
But
might
then
get an answer which to please
others,
you.
that the senior residency is probably the most important point of your surgical training. You are training juniors and you're also learning. So I think it's a very important point of your, as a postgraduate, you're always under the shadow of the senior resident and the consultant. Senior resident, you are the boss. So you you have to take the decisions. So in the emergency, you have to take the decisions. Bosses didn't like to be called unless they were really required to be called. So you have to take the decision. So I think that I value that thing. It helped me to navigate an MCH where I didn't learn much, but I could still become a good GI surgeon because of the experience of my senior residency.
So that period is very significant, that post MS
Yeah,
one.
I think so.
And
I
how
think
many years do you
I
think?
I
I
did
I,
three.
I also did 3 years, but I have a very strong conviction that when people come to these days join DNB, the only question they ask is how much hands-on training I'm going to get there,
Yeah,
how
that's
much
that.
cutting I'm going to get. So I feel very surprised that we've reduced surgery to a technical exercise that the only thing that matters is cutting. So, which is sad that we have not given a cerebral dimension to surgery. This we have failed. So I realized maybe as a senior resident, I may have got knowledge, I may have learned few technical skills, but to graduate to a power, to a status when you can decide, it takes a long time because there is no escalator to it. There's only
Some
a
surgeons never
staircase.
learn. I
You have
mean,
to take your time. It takes a long time to translate knowledge into wisdom. It takes a long time.
and some people never gain that wisdom. Isn't it true, Adarsh?
In my case, it may be true, but not in your
Not
case.
in your case, but I'm saying in general in among surgeons, I see some of them who will operate anything that comes. They don't care. They just want to show off their surgical skills. When the patient lives or dies, they don't care. Whereas we are bothered about what will be the outcome. We think about it before we operate. So I think that that's very important. So I look at a patient who has got a right hemicolectomy, but who's got a serum albumin of 2.8. I tell them that, look, I'm going to do an ileostomy at the end of this operation. I'm not going to do the anastomosis. And sometimes the others say, but we have seen people doing the anastomosis. I said, how many have you seen leaking? They said, yes, we have seen a few leaks. I said, how many did you see dying? They said, we see
I
somebody dying.
have I have a suggestion. Whenever there's a surgical workshop, after the surgical workshop is over, after 2 to 3 days, the patient should also be shown what happens after the workshop is done. Because
No,
I've seen,
they don't. I will tell you, I was at a workshop in a place I won't name, and I was asked to do a right hemicolectomy on a patient. The I could see the patient lying 10 feet away on a bed, and I could see the mass from 10 feet away jutting out of his right iliac fossa. It was a thin, emaciated patient. I said, this patient, laparoscopic hemicolectomy is out because I will need a 15 centimeter incision to remove that tumor. So best is do an open hemicolectomy, do an ileostomy, try to salvage his life, and then if he survives, give him chemotherapy, and then later if he improves, rejoin the two.
Ramesh, to my mind, this is a fantastic bit of teaching. This is the what real teaching is to decide how to change the trick in between. How do you match patients to surgical procedures? I think that itself is a great learning. Am I right, Patta? That's what we need to teach,
Absolutely.
how to change your path midway and things like that.
Absolutely, because Dr. Ramesh is a very workshop man, that he operates everywhere and anywhere. And I'm sure, I mean, I wasn't aware that he looks into all these because,
No, I am very clear. I refused to do that case, and it was done by somebody else. And the thing is that after 4 hours of surgery, to remove the tumor, he had to make a 15 centimeter incision. And everybody asked the same question. Dr. Ramesh has already said you need a 15 centimeter incision to remove the tumor. Why did you not do it by open and finish it in an hour? And the unfortunate part, which nobody knows, is the next day the patient died. So, this is what we don't tell in our workshop, what happens the next day. And we don't see patients. I pointed out after an anterior resection that the end of the anastomotic descending colon looked blue. And the surgeon dismissed my arguments. And at the next day, they showed the patient walking. And they said, Ramesh, you said the aneurysm is blue, but see, he's all right. I said, the leak will occur on the fourth day. And nobody knew, but I knew from sources that the patient leaked on the fourth day. He was on a ventilator for about 4 weeks. And then, because they had done undone aneurysms and all that, then with great difficulty he pulled through. So this happens. That as he says, nobody tells what happens 5 days after the workshop.
That Adarsh, why did you choose government sector? Why not private sector after you sort of trained well enough?
At that time, Dr. Radhakrishnan, the private sector was not very developed, and it used to be a great honor to get a government job. And at that time, getting into a place like GP Pant, it meant a lot. And I don't even think I was confident enough to go into private practice. Whatever I'm today is because of my work in GP Pant Hospital. I love teaching, I enjoyed teaching, and it was a great department. And I think I have no regret
If
on
there
that.
was a good private sector hospital, would you have chosen to join them?
I don't know. I won't be able to answer this question, but I was very happy that I joined GP Pant. The patient load there was great. I could publish a lot. I could do a lot of writing work. It satisfied my academic quest. It satisfied my teaching abilities. So I would not have changed that.
Dr. Ramesh, why did you join the government private sector?
Because there were a lot of, see, if I had to join the private sector in Tamil Nadu, in Tamil Nadu, there's a bias against certain castes and communities, and I would have been played around like a football between various places. I had no power, nobody I knew in power. So I would have been played like a ping pong, so I didn't want to join. Secondly, I had to pass an exam in Tamil, which I would have never passed because I didn't have any Tamil training because I studied in Jharkhand. I knew only Hindi. I didn't know Tamil. I could speak it, but I couldn't write it or read it. So I would have failed in the written exam. So I would have never progressed. So I decided to join a private hospital just coming up. And in retrospect, it was a good judgment because I was the only surgeon. There are a lot of cases. So I was able to do a lot of cases. I got access to instruments early, like laparoscope, endoscope, ERCP scope. So I started doing all those procedures, and it helped me to establish a name across the surgical field.
Now, you could have joined CMC Vellore, you could have joined
Yeah, actually, I was
All
offered
India Institute. Why didn't you consider any of those?
Yeah, I could have joined any of those, but at those days the pay was very poor in both All India Institute and in CMC Vellore. CMC Vellore was very poor. All India Institute was a little better, but I was a single worker. My wife was not a doctor, so I had no background. My father didn't even have a house. He didn't even have a house when he died. So I had no background. So I needed some money. So I joined somewhere where they would pay me a little extra, and then I could grow up with that extra money. And I suffered from the lack of funds in my childhood. I got an opportunity to go to England and I couldn't go because there was no money to buy the tickets and go. So I didn't want my daughters to suffer from such similar fates whenever I had children. So I joined the private sector and grew with it.
Now, Adarsh, both of you are surgeons, and you've seen the transition from open surgery to laparoscopy to robotic to transplant. All these happened during your time period. You've been very selective to choose certain advances and not so selective in certain others, unlike Ramesh. Why? What is the one? What is your explanation for that?
No, your inference is not correct. I'm very aware of my limitations, but I have a team which does everything. We do robotic surgery, we do laparoscopic surgery, we do everything. So there is nothing that we don't do. I've been very lucky to have a team, and we do 290 to 300 cases every month. Can you believe it? So
And I think you didn't get my thing. You shouldn't mind my saying this, because
no, I don't.
it's your team which does. But did you have any selective like or dislike to it?
No, I have no dislike. When I was in GB Pant, I was regularly doing laparoscopic surgery. I did a lot of laparoscopy in GB Pant. When I came to Gangaram, unfortunately, there wasn't much opportunity because there was no theater time. So that's the 5 years because we could not get the laparoscope. Gangaram had a lot of issues about time and all. So when we came to Medanta, then I had people who were doing much better laparoscopic and robotic surgery than I was doing. So why should I be doing everything? So I'm not deluded by the fact that I can do everything.
But don't you have any bias towards? It is a patient with a
No,
low rectal tumor.
I believe
How do you choose whether it's open or robotic?
always laparoscopy is better, minimal invasive better. We have absolutely for some surgeries we rarely do open surgery, but my basic interest is pancreatic surgery. Some people can do Whipple's laparoscopically or robotically. I do my Whipple's by open technique. I'm sure there are people who can do laparoscopically, but I do my pancreatic dissections on the Whipple's always is open. But if it's a distal pancreatectomy, it's nearly always laparoscopic. Colorectal surgery is always laparoscopic. Esophageal is robotic. Gastric is mostly laparoscopic. So what I'm saying is that there are people who can do better than me, so why should I muddle in that? So I do my bit, they do their bit. So that's how it is.
That's great. That Ramesh, you've been a technocrat. You went into endoscopy, colonoscopy, ERCP, then laparoscopy and robotics. What is it that drives you?
Let me make you correct. I didn't go into robotic in a big way because by the time the robot came to my hospital, I was in my early 60s. So I decided that robotics should be given over to the younger surgeons. So I handed it to the younger surgeons to do. I continued to do the cases that came to me by laparoscopy, and some of them they would come and say, "Sir, we can try this robotically." I would give it to them, my own cases, and allow them to do it robotically. So I encourage them to do robotic surgery as much as possible. As far as laparoscopic surgery is concerned, yes, I was one of the very early uptakers of laparoscopy, especially advanced laparoscopy, along with Palni. We both were sort of the pioneers in lap oncology in the 90s across the country. We went and demonstrated in many oncological centers, and we showed them that it can be done safely and well. And as far as endoscopy work is concerned, there was no endoscopist, so I had the endoscope, so I did it. When the endoscopist joined us, I handed it over to them and said, "You do it. I will support you in any way you want. I will teach you also if you are not very confident." And I did teach quite a few of them how to do the early ERCP. And then when they picked up, I just walked away from it.
But that Adarsh has been a prolific publisher, writing papers. What induced you? Is your training in Chandigarh or subsequent stay in Pant, or you had time to do all that?
What do you do when you are hungry? You eat. So I had a hunger to publish.
Where do you get that hunger from?
It's a genetic malformation. So most people have stopped writing. I continue to write. I continue to publish. Many people who are with me in government sector, when they were in, say, SGPGI or AIMS, they were publishing. Ever since they left, they stopped publishing. I continue to publish because I enjoy doing it. It gives me an opportunity to express myself. So I do it just for myself. So I enjoy it. That's why I do it.
That Ramesh, you've not been very strong in this area.
Yeah, we have
Right.
published quite a bit. but not many major case series, but we have published a lot of case reports and some series. And I do get from my ResearchGate and Academia Union, a lot of times my papers are read or cited. So I know that there is some good work which you have done, which you have published. But then the problem is in a private hospital, you don't get the same backup of, say, statistical help and secretarial help. They are inundated with discharge summaries and bills and this. So somebody to do all this work is not available. So that is one of the reasons why. And our PGs nowadays, somehow they are not very keen on publishing, even though I keep telling them there's so material, you do it. They are just not very keen. They want to, as he said, cut and then go.
Dr. Adarsh, what is it that your trainees like in you and what is that they don't like in you?
These are questions I will not be able to answer because I've been
You've been
unvolunteer.
evading every other question, as a matter of
No,
fact.
because your questions are written with total subjectivity. In a recent meeting, somebody was asking me, how do you behave with your patients? So I said, I really don't know. Thank God I said that. And in between, one person in the Zoom meeting said, my uncle was admitted. You were very rude to him.
I was part of
Yeah,
that.
so I really don't know. I really don't
Yeah.
know. I just many times think I have one thing which I am very proud of. I want to be value strong. May not be skill strong. I want to be value strong. That I don't want, people might say he's a useless surgeon, but I don't want anybody to say he's intellectually dishonest. That's my only thing. I strive for it. Rest does not matter to me. There may be 50 people who say I'm a useless, well, I don't care. But I should be intellectually honest. That's my only desire. And I work towards that. Rest for me is dust.
And you make sure that your trainees are trained well.
Oh, yes. Oh,
How?
yes.
How? You're
Okay,
in a private sector.
Oh, yes. No.
Every patient comes to you, wants to be operated by you.
Oh, our trainees, if you see, some of the best surgeons in the country today are my students. If you ask me what is my one big earning, it's my students. Knowledge is not centripetal, it's centrifugal. If you ever come to my operation theater, I'm a compulsive teacher. I enjoy it. That's my love, and I do it, and it's my duty also. Because if he's holding my retractor, he's listening to bad things I'm saying, he's also entitled to get all my knowledge, all my wisdom, all I've accumulated to them. Because I believe that a poor man in Jaipur or Bhopal cannot come to Delhi. My student there can do good work and save somebody's life. That's my biggest reason for teaching. I think that's my duty to do that. It might sound idealistic, but it's a fact.
That Ramesh, your students adore you. It's just they didn't build a temple for you, but they adore you. They made movies on you. And what is the secret? Why is that?
Because just like others, I give all my knowledge to them. I mean, I don't keep back anything. I mean, whether it is in the morning meeting, I correct them. I tell them that this decision is not correct or this decision is correct. And then I tell them why I disagree with the decision that they have taken and why I would do it in a different way in an emergency which they have tackled. And in the operation theater, I give them a lot of independent chances. Initially, we start slow. So with the first year, he will do maybe the GJ of a Ripple. In the second year, he will do the HepJ and the PJ. And the third year, he will do at least 2 or 3 ripples independently, do phrase independently, do total gastrectomies independently. And then so we allow them to do this. This is one of the reasons why I have now slowed down on my laparoscopic work in most of these fields because if I do everything laparoscopically, now a lot of the junior consultants want to do things robotically. So they are taking away a chunk of surgery. So I do less of my laparoscopic work and hand it to them so that they can get a chance to do it by open methods and learn how to.
Now, both of you are very prominent people in any of the GA surgical conferences. And you openly criticize and I mean, you two are the sort of firebrand type, we can say. Now, how important is it for the trainees to attend conferences and speak boldly like you?
It is very important. See, we are not firebrand, but we tell our views in a way that seems as if we are arrogant. But it's just that we are both, I think me and others, we are both quite firm in our opinions.
You call a spade a spade.
We put it in words that don't leave space for argument, because we don't want to make, there are surgeons who will answer, oh, you can do this, you can do that. No, we will tell them, this is what I do and this is what I would like you to do. For example, a simple thing is this argument of subtotal cholecystectomy versus cholecystectomy. And I'm a strong proponent of not doing subtotal cholecystectomy. I tell them that every time you can do a total cholecystectomy if you're persistent enough. And all my PGs go ahead and do total cholecystectomies, and they don't cause CBD injuries. And so that is an important factor. We must factor that you do this, but don't create the injuries. In some operations, I've seen them beginning to do a subtotal. I tell them, no, you cut that peritoneum and push it down, you'll find the cystic duct. And when the surgeon has followed it, the cholecystectomy has been a total cholecystectomy and not a subtotal. So we are firm in our opinions, and others is also firm in his opinion. And sometimes we disagree with our opinion. My opinion and others' opinion may be completely at sea, but neither is wrong. In medicine, there are more than one ways to skin a cat. So both of us may be right, and we speak from our experience. So I respect his opinions. And sometimes I've changed my opinion because of him. And sometimes he has changed his opinions, I believe, because of what I've said over the years. So it just happens.
The others, if I stand corrected whenever I ask you a question, you shifted to philosophy and stuff in the last 5 years or so. In all the meetings, you talk about philosophy of surgery. But is it some sort of the end of the road, or why you got into that?
That's the topic which has been given to me. So I was I was always a philosopher, but my goodness was never recognized. So I don't choose. So it is just that what is given to me, because I think they got tired listening to my talks on pancreas or bile duct strictures, and maybe that I have just no clue why I'm not considered a surgeon now. They just everybody wants me to talk on. I was always a philosopher. I was always a voracious reader, but I don't know what happened, what changed.
Philosophy also carries lessons for surgeons. Pata, his philosophy carries lessons for his surgeons, because the philosophy is not, he's not talking of, the spirit healing or something. He's talking of philosophy as applied to surgery, which I think is because people recognize his wisdom from his years of operating, seeing complications, dealing with difficult patients, seeing patients, and he has now gained a vast amount of knowledge. And that knowledge of philosophy is something that I think will change the outcome of many doctors' ways of practice. So I think it's not something wrong. It's now the wisdom that's coming out from his years of experience.
I like the way Ramesh has put it. Also, when you start a surgery or something, you have an advanced tumor, you can only do a good nodal dissection, work hard. If you have a philosophy saying, I am an important prognostic factor in this patient's life. If an operation is just a technical exercise, it's different. When I was doing Whipple 15 years back, my aim was not long-term survival. My aim was that this patient should go home. I'm confessing that should not have a pancreatic leak. I only had short-term goals. That this patient, the first shunt I did, my aim was not that the shunt should work. My aim was patient should not die, the shunt may not work. Now I realize I am an important prognostic factor. I am a modifiable factor in patients' outcomes. So that's where philosophy counts. There are days when you are operating at 3 o'clock and it's 9 o'clock in the evening. You say, oh, it's 9 o'clock. Then your philosophy tells you, no, patient made no mistake. You started late. So I think that's where my philosophy is not kitchen table philosophy, talking high things. My philosophy is how to be true to what you're doing. I'm an
Wonderful.
ordinary man. I have no extra skills.
That's
But
great.
you need some sort of
I
crutches in your life.
I disagree with that. I've seen him operate. He does have skills that come, when you take the dumbbell, he has skills that come under the flat line of the dumbbell at the higher range of skills. So let us not cut bait here. He's exceptional, sir. No questions
No,
about that.
no, Ramesh, I think thanks for saying that. We both, I think, you don't talk philosophy, but you think philosophy, right? Like the thinking, some people say it, some people don't say it, but essentially we all need to have a degree of philosophy. What's the problem with Santosh John Abraham? For 10 years, he sends mails at night to for the ASI, do this, do this. Why should he do this? It's a philosophy that I have to do something meaningful. So it comes from philosophy only, right? We believe philosophers are living in ivory towers, thinking it's not like that. Philosophy is giving a meaning to your life, whatever you are doing. That's what I mean. What about it is?
Wonderful, sir. On that note, I'll leave the thing open to all the big shots over here for their comments and any queries. I mean, it's wonderful talking to both of you.
Thank you.
Thank you, Patra.
Thank you very much, Dr. Pattarashna, and both the eminent surgeons and speakers. I would request now Dr. Siddesh to chip in. Dr. Siddesh.
Oh, thank you, Santosh. It is really an honor that you asked me to talk about these two legends when they are there on the line. I think the last 1 hour has been really, I don't know how it went through. See, I think if really, I wish many of the youngsters who are about to start their career has gone through this, heard this with an open mind. See, there is so many things which can be learned out of this. What is life to offer them? Not just surgery. There is so many things which you can, and that itself will shape your character in the long run. I think that is the way the whole essence of today's talk and interaction has gone through. And Patta Radhakrishna has really brought them out in their elements, both of their characters and their likings and their structure, what you can call them. It is not just their character and their excellent surgery what they perform. There are always been very good teachers, and there is something beyond surgery which you can pick up from both these characters. Thank you very much for giving me this opportunity to share my views. I have been lucky that they are close to me, and I have learned a lot from both of them. Thank you.
Thank you. Can I have a word from Dr. Prabhu?
Good evening, sir. Good evening, everybody. It's been absolutely amazing to hear from true legends of surgery and general surgery. One leading the fort in North India, the other one in South India. We have a pan-India presence here, and I have been in awe of both of them since I started attending IASG conferences right from 2000. And these were people who are not only teachers, but they are an amazing human beings as well. We've learned so much from them, not only in surgery, but from other aspects of life. I'm really, really grateful to both these legends for shaping my career and careers of many others. Thank you very much, Dr. Adarsh and Dr. Ramesh, for being with us and encouraging our students and our residents and our junior surgeons on this ASI platform. I'm really grateful to both of you. And thanks to Patta for organizing this, the boss of Facebook, Learning General Surgery. And thank you very much for giving this. And my thanks, Santosh, for asking me to speak on this momentous occasion. Thank you so much.
Thank you very much, Dr. Prabhu. Can I have a quick word from Dr. Praveen?
Good evening, everyone. Again, thank you so much, Dr. Ardhanari and Dr. Adarsh for sharing not only the surgical nuances of your success, but the important things beyond operation theater that makes the surgeon more meaningful. So thank you so much. And we, from our residency days, we have seen you, we are ourselves witness your interest and passion for the training your junior surgeons. I'm sure those who came in contact with you. Must have been it must have been a great opportunity for those, and I'm sure they will carry forward your this legacy to the next generation. Thank you so much.
Thank you very much, Dr. Bharati, Vice President.
Yes, sir. I think today's day, I think, should be inscribed in golden letters as two legends in surgery. Respected Dr. Adarsh Chaudhary sir and respected Dr. Ramesh Ardhanari sir were here to grace us at this ASI time. And added delight was Dr. Patta Radhakrishnan, who was Director Surgical Gastroenterology, SIMS Hospital, Chennai, was moderating the entire session. So today's session was not just about listening to these great minds or admiration alone, but I feel it's about absorbing essence of their journey. How did they do when the thing goes, the odds were against them? And most importantly, after listening to both the talks and the interviews, we got enough to take back home in our journey as surgeons and professionals. So today's session, I feel, was a great academic, enriching experience for all of us. Thank you very much, sir.
Thank you very much, Dr. Bharati. Dr. Gaddi Divakar, Secretary.
Good evening, all. Thank you, sir. Uh, Good evening. As a junior most sharing screen with all the seniors, it's really what you call my good fortune, I should say. And I've been ardent admirer of Dr. Patta Radhakrishna sir in his Facebook page. I religiously follow that, and it's really enriching experience going through that. And again, hearing from directly from the horse's mouth, Dr. Adarsh sir and Dr. Ramesh sir, this has been a really Hatke talk. So we can say that it's learning from the legends. It was, as Dr. Varute rightly put it, it is an enriching academic experience. It showed us how a teacher should be and how we should have a lateral thinking. I think at different stages of our life, the different facet comes into existence. Once we'll be a teacher, other time we'll be a philosopher, as rightly Dr. Adarsh put that. The insights shared by our speakers have not only highlighted the surgical excellence but also emphasized the values of perseverance and the importance of lifelong learning. Definitely, this interaction um, will guide the younger surgeons while reinforcing the principles that define our profession. Thank you all for joining in this ASI time. Thank you very much.
Thank you very much. Before I call upon Dr. Madhumita, a quick word from Dr. Rajgopal Shenoy, on whose behalf I was trying to coordinate all these things. Sir.
Hello? Hello?
Yeah, you're audible.
Firstly, congratulations to the entire ASI team, we'll put it that way. My quick message after everything is that in a success story, it's all about 1% inspiration and 99% is perspiration. And also, the success comes not by lift, success ladder, it should come by ladder, step, every step. Dr. Patta Radhakrishna, Dr. Adarsh Chaudhary, Dr. Ramesh Ardhanar, all are legends and moderated by a legendary. And the topic title also is such a beautiful topic, learning from the legends. Sir, wonderful, sir. Youngest generation and everyone to learn from this. Thank you, sir, giving this opportunity here. Madhumita, madam.
Madhumita, please.
Thank you, sir. This was a really interesting session, and I was hearing it spellbound, rather. I was really spellbound. Thank you, Santosh sir, and thank you, Shena sir, for arranging this kind of a program. It was, actually, it was an honor to listen to the legends in such a way. Thank you, Probal sir, Siddesh sir, our Vice President, Dr. Barute, immediate past president. Thank you all for your views. Um, Thanks to our moderator, Dr. Patta Radhakrishna. It was like, and we had two panelists who are supposed to be firebrands. So, thank you, Dr. Radhakrishna, for bringing out this fire out of these firebrands. It was really wonderful listening to you all, and so many thoughts, kind of things like the philosophy of being a prognostic factor. I have never heard about this before, and I was just thinking on it. It makes you think, and then that things like that we really don't tell what happens in a thing, or what happens the next day in any case of a thing. So these are kind of things really which you makes you think. So thank you so much for this session. It was really wonderful. Thank you, Gaddi sir, our secretary who works behind the scene. Thank you all for so many. Thank you all the viewers. Long live ASI.
I'll be failing him in duty, though it's little
So,
too late to call upon Dr. Marithu.
yes, sir.
Quickly, a few words. Dr. Marithu. Dr. Marithu, can you just come in? You're muted, sir. Hello, sir. We have finished the program.
Yes, sir.
Yeah, if you want to say something, please.
Sir, I want to thank all the panelists, especially Dr. The moderator, Patta Radhakrishnan sir, one of the vociferous writer, always like his writing in LGS. And Adas Chaudhary sir, he may not be knowing me, but I have admired his debates rather than his free lectures. Whenever he is going for a debate, even the opponents will surrender before him. Like that, he's a good academician, and as far as this debate is concerned, of course, Ramesh sir, very lately we are enjoying this your expert comments are during live surgery. Many of the laparoscopic live surgeries, whenever I attend along with him, I will always appreciate his comments during live surgery. So thank you, sir, for all your good thing having participated in this program. Thank you, sir. That's all.
Thank you very much. On behalf of all the ASI headquarters, office bearers, I profusely thank Dr. Patta, Dr. Adarsh, and Dr. Ramesh Attanari for the wonderful session. We'll come back again next week, same time for ASI 10. Till then, good night to all and stay safe. Good night.
Good night.
Good night, sir.